We treat chronic venous insufficiency. So chronic venous insufficiency is a disorder where the blood in your legs have difficulty moving back up to the heart. Normally on its way up from the legs, the blood passes through a series of checkpoints, which are one-way valves, and these valves help the blood flow in the right direction and not reflux back down in the wrong direction. Over time, the valves themselves or the vein walls can become weakened, and it allows the blood to flow back down the legs and pool in the lower legs and cause symptoms of chronic venous insufficiency. If you have any symptoms of swelling in your lower legs or painful, crampy legs, or if you notice any significant varicose veins, it's worth having a discussion with your primary care doctor or reaching out to us at the Vein Center, and we can see if you do have a diagnosis of chronic venous insufficiency, and we can come up with a plan to help manage that. Typically, what we recommend first is conservative measures, which are non-procedural. This involves compression stockings, leg elevation, treating modifiable risk factors. However, if those symptoms don't improve over time, or if the symptoms are very severe to begin with, we would recommend a procedure to help treat the diseased vein. So the main procedure we do to treat chronic venous insufficiency is called radiofrequency ablation. This is a procedure that's done here in the procedure room, in the office. You walk in, we do the procedure, you walk out. You're awake for the whole procedure. However, we put some numbing medicine in your leg so you're fairly comfortable throughout the procedure. It involves putting a catheter into the diseased vein, and then we're able to heat the inside lining of that vein up to help seal it closed. And this redirects blood flow from the diseased vein back to the normal healthy veins that are deeper in your legs. So many patients feel an immediate improvement in symptoms after their procedure. At Schneck, we're treating more than just the disease process itself, but we're treating the patient and finding the best way to manage symptoms. Risk factors for chronic venous insufficiency, there are many of them. The most important one is out of our control. It's actually our genetics. If our parents have varicose veins or venous insufficiency, we're at a higher risk of developing them ourselves. Other risk factors include age, because the vein walls weaken over time. It's more common in female patients because of hormonal changes and pregnancy. More common in patients that carry excess weight and smokers, people that have had previous blood clots or trauma to the legs or previous surgeries to the legs. And probably the most common risk factor we see is those that have jobs that you stand or sit for a prolonged period of time, because that just allows the vein or the blood in the veins to pool in your legs, and they're not being pumped back up to the heart by movement. At the Vein Center, we're here to help your symptoms. When you visit us first, you get to meet our whole team. We do our history and physical exam. We're able to diagnose any venous insufficiency at your initial visit, because we do an ultrasound at your first visit. So we're able to look at any abnormal veins. We can see if there's any refluxing in the veins, if there's any blood clots, and we can come up with a treatment plan just at your first visit. A lot of the times people don't seek treatment initially because they think it's just a cosmetic thing with the varicose veins and the spider veins, but these symptoms can progress on and become more severe, and it's better to get these treated early rather than later.